Early onset scoliosis is a condition that affects children under the age of about 10. It used to be classified as infantile or juvenile scoliosis, depending on the age of onset. We tend to look at both those groups together these days. The reason early onset scoliosis is quite important is because of the effects of the spine deformity on the developing lung. A young child's lung develops over stages in the child's life. Typically, it multiplies the number of air sacs, peaking at about 8 years of age. Therefore, any curve that occurs before that time, affecting the shape of the chest wall, will affect lung development. This is why it's crucial to treat early onset scoliosis effectively in the young. I have several years of experience in the management of this condition. I established 2 centers of excellence in early onset scoliosis management and have considerable experience in the non-operative treatment of this condition. Typically, when we see a young child with scoliosis, a workup includes an MRI scan in addition to X-rays. The MRI is all the more important if we contemplate surgical treatments in these children. Non-operative management in this young group of patients is typically with casting. The casting was first described by 2 French surgeons in the 1960s and popularized by Dr. Min Mehta. This is often referred to as Mehta casting. We do this in the operating room under anesthesia, changing the casts over the period of time, leaving them on for 3 to 6 months. The curves tend to stay stable in these casts. My experience and most literature suggests that about a quarter of patients with early onset scoliosis will have a cure, which means that their curves will be completely corrected with little risk of recurrence later on. However, a quarter of these patients will end up needing surgical treatment. The surgeries that we do in these children involve growth-friendly approaches, the most common ones being a rod called the magic rod or a magnetically driven rod. These are of course placed in the child under anesthesia in the operating room, and the hospital stays vary from 2 to 5 days. The advantage of the particular rod is that lengthenings can be done in the clinic without any surgery. This is a fairly painless technique when they come back for the lengthenings, and children do very well. The goal is to try and get the child to past 10 or 11 years of age and then consider one final fusion if they need it. Please look at the links that are available on our website to research this condition further. Thank you.